So I've checked the patient's chart and I've performed proper hand hygiene. I'm going to enter the patient's room and introduce myself. Hi, I'm Becky. I'm your student nurse today. And can you please tell me your name? What's your date of birth? Okay, 12/3/12. Good. And I have performed hand hygiene, and I'm going to provide the patient with privacy. I'm going to explain what I'm going to be doing to the patient. I'm going to be doing a head and neck assessment. Is that okay? Okay, thanks. Okay, first I'm going to palpate the head. Have you been having any pain in your head? No. I'm going to feel for any kind of lesions, and her head is symmetrical, and it's normal cephalic, not micro or macro. I don't notice any sores or abnormal bumps or anything like that. Okay, great. Can you take your head up, please? Now I'm going to palpate the temporal artery. Okay. Now I'm going to palpate the submandibular gland. Can you open up your mouth, please? Can you shut it and open it again? Okay, and that is assessing cranial nerve number 5. Okay, I'm going to have you puff your cheeks and raise your eyebrows. Great job. Okay, and that's assessing cranial nerve number 7. Okay, next I'm going to do an assessment on your eyes. Okay, I'm going to have you look straight ahead at me. Great, thank you. Great, thank you. Eyebrows look good. They're symmetrical and even. Eyelids and eyelashes are also look good. Okay, thank you. Have you been having any kind of pain in your eyes or a hard time seeing at all? Okay, great. I'm going to have you follow my light with just your eyes. You think you can do that? Okay, just your eyes. Don't move your head. Okay. Okay. And good job. Okay. Now I'm going to look inside your eye, okay? Okay, the conjunctiva is pink and moist. The sclera is light. Looks good. And her pupils are round, equal, reactive to light, and accommodate, actually. And that tested cranial nerves 3, 4, and 6. If I noticed a problem with her eyes, I would administer the Snellen test, which would assess cranial nerve number 2. Okay, thank you. Next, I'm going to assess the patient's nose. Hi. Okay, the outside of the nose looks symmetrical and even. The skin looks good and intact. Can I tilt your head back? Oh, thank you. Look inside of the nose. I don't notice any polyps, any kind of lesions, any deviations, perforations, or anything like that. Inside of the nose looks good. It looks moist. Alright. Now I'm going to administer a smelling test. So, can you tell me what that smells like? Nothing. Okay. So it smells like coffee today, and that is assessing cranial nerve number 1. Okay, great. Now I'm going to palpate for the sinuses. This is the maxillary sinuses. These are the coronal sinuses. Palpating for both of them today. Okay, great. Thank you. Okay, now I'm going to assess the patient's mouth. I'm going to have you open up real wide. Okay, I'm going to have my little tongue suppressor, and I'm going to test the patient's gag reflex, which tests cranial nerve number 9. Okay, I'm going to have you stick out your tongue and say ah. Ah. Okay, uvula moves up with a soft palate in midline, which indicates that cranial nerve number 10 is intact. Stick out your tongue for me one more time. Stick it out. Good job. That indicates that cranial nerve number 12 is intact. And open up. The buccal mucosa, the hard palate, and the pharyngeal wall all look good. They're intact, pink, and moist. I don't see any problem with her teeth or dental work of any kind, no dentures or anything like that. Do you have any mouth pain today? You do? Where? Okay, so the patient said they don't have any mouth pain today? Okay. Next, we're going to assess the patient's ears. So I'm going to Palpate the ears. I'm going to push and behind into the mastoid. So I'm going to push the tragus, pull the pinna, and push the mastoid to assess it. You having any problems hearing today? No? Everything feels good? No pain? Good. I'm going to look inside of the ear for any kind of foreign objects or discharge of any kind. Have you noticed that you've had any kind of discharge? Good. Okay, and if the patient indicated a problem with hearing, then I'd administer the whisper test, which would indicate that cranial nerve number 8 is intact. Or assess it, rather. Okay. Looks good. And the ears are symmetrical. The auricles are midline with the eyes. Looks good. Next, I am going to assess the patient's lymph nodes. Can you hold my pen light? Okay. So preauricular, postauricular, tonsillar, submandibular, submental, precervical, postcervical, occipital. Can you supraclavicular? Can you put your head to the side, please? Deep cervical, put it to the side. Deep cervical. I also wanted to know a good range of motion with the neck. Looks good. Thank you. Okay. Now I'm actually going to come from behind. Can you swallow, please? Okay. The thyroid feels good. Feels intact. It doesn't feel like anything's wrong with it. It's not swollen or anything like that. Okay. How are you feeling today? How's your neck feel? Does it hurt? No, it feels good. Okay. Thank you. Can you tell everybody bye? Say bye. Look at the camera.